I'm going to hit record now before I forget. So thank you everybody for being here this afternoon. We're really looking forward to our public health career panel. For those of you I don't know, I'm Heather Drake. I'm the Membership and Engagement Director with the Maine Public Health Association. And I'm really excited to invite you all here this afternoon as part of National Public Health Week. And today focus is on the public health workforce as well as students. So doing today, in celebration of students and in trying to encourage more people to join the public health field. So I'm really thankful to all of our panelists for being here with us as well. And once I get through housekeeping, you'll be introduced to all of them, hear their stories, how they got to where they are in public health, and then we'll have lots of times for question and answers. So if questions come up as panelists are speaking, please feel free to put those in the chat. To go over housekeeping, you've probably all been alerted, but we are recording today's panel and we'll send that out to registrants after the event, and we'll also post it on MPHA's website as well. We do ask that you stay muted until the question and answer, just to limit any background noise, though I'm sure my dog will bark at some point during this introduction. And as I said, if you have any questions as we go through the panel, please put them in the chat, or you can wait until the end and we'll have folks come off mute to ask questions. And you should have access to closed captioning if you need that. And we will be asking that everybody take an evaluation, so we'd appreciate it if you'd stay on it until the end to get that link, but we'll also include it in the follow-up email as well. And then I also want to remind you all, and I'll put all these links in the chat, we are hosting another event for National Public Health Week tomorrow morning at 9 on the current state of PFAS in Maine. So if you're interested in the environment in PFAS and its impact that it's having on communities, especially tribal and rural communities, we'll be talking about that tomorrow morning. And then Thursday, we're having an MPHA member networking event and walk pending any rainstorms at 4:30 in the Portland area. So we hope you can join us. And if you're not yet a member of MPHA, we are running a special this week as part of National Public Health Week, but the student rate is lower than the special. So it's $10 to join if you're a student, and I'll put the membership link in the chat as well. But I think that's it for housekeeping. So I will turn it over to Mackenzie to do our introductions.
All right, thank you, Heather. Hi, everyone. My name is Mackenzie Amity. I am a student at the University of New England in their graduate program of public health, pursuing my master's currently, and I'm very excited to be co-hosting this panel with Heather and the MPHA today. So I'll just give a brief introduction to all of our panelists, and then we'll obviously hear more from them as they talk about their public health careers and experiences in the field. So our first panelist is going to be Dr. Titilola Balogun. She is the Assistant Director for Public Health Practice at the University of New England. Our second panelist is Sue Mackie Andrews. She is the co-founder of the Maine Resilience Building Network and the chair of Penquist District Public Health Council. Next, we'll hear from Carol Ewan White, doctorate and Masters of Science. She is the Assistant Director for Public Health Research and Service and a public health expert at the University of New England as well, and their online programs. Then we'll hear from, he has a master's in public health and is the associate director for the Children's Oral Health Network of Maine. Next, we'll hear from Dr. Ivan Most. He is the president of Strategic Occupational Health Management, and he is an adjunct professor at both USM and UNE in their public health programs. And lastly, but not least, we'll hear from Yvonne Jonk. She has her doctorate, and she is the associate research professor at the USM Muskie School of Public Health and at USM in general, and the deputy director for the Maine Rural Health Research Center. So we're very excited to hear from all of these panelists today. They all have a lot of wisdom to share with us. So with that, I will turn it over to TT.
Thanks, Mackenzie. Thank you, Heather, and thank you, everyone. It's an honor to be on this panel to share my experiences and my journey through getting to where I am at in my career as a public health professional. So my background really is in clinical medicine. I went to medical school in Nigeria. I'm originally from Nigeria, and went to medical school, and I thought all my life, all I wanted to be was a pediatrician. And I was in that life, running clinics, pediatric clinics. And at some point, I found that I was seeing in the particular community where I was working, I was seeing the same kinds of cases over and over and over again. I would attend to some patients, and my patients were mostly children younger than 5. In fact, most of them were younger than 2, who had most of them nutritional disorders or problems with nutrition. And I would, see these children in the clinics, give some kind of education to the mothers on how to take care of their babies. They would do better, they would go home, and then a few months later, they would come back with the exact same problems as before. And I began to feel like my efforts weren't going anywhere. And I'm that person who always asks why. So I began to ask myself, so something must be happening that I'm missing. It's not that the mothers are not comprehending the information. Something else must be going on. And it turns out I was right. There were many factors in the community that were impacting the mother's ability to carry out whatever instructions or maybe fulfilling any prescriptions for the children. Factors that were beyond their control, factors that were occurring in the community. And in that instance, I realized that I had all this knowledge about medicine, but I didn't know how to tackle the problem from a community-based perspective. And so that was what drove me to consider pursuing an MPH. So from clinical practice, I went to get my Master in Public Health degree from the University of Texas School of Public Health in Houston. And my goal was to just get an MPH and then return to clinical practice. And when I was in MPH, wrapping up my program in MPH, some of my advisors were saying to me, well, Titi, you can teach, you can really pursue a career in teaching. And I actually at that point began to feel like, yeah, honestly, I think I really do want to teach, but I love clinical practice. And so I decided, okay, maybe I should go for a doctoral degree. And I went into DRPH. Actually wanted to do a PhD at first, but then opted for a DRPH. And that just opened up a wealth of opportunity for me in public health leadership, public health practice. And so I found myself doing research, which I love to do, teaching, which I love to do, and fully engaged and helping students to be engaged in public health practice. So that's my journey. It's been a whole world of difference from being a fully clinical practitioner to now having a full community-based focus. But that's what the journey has been like for me. And I'm thankful for how just everything has just panned out for me. So that's it for me for introductions.
Thank you so much, Titi. It's really interesting to hear about your background in medicine and your transition to the public health field and what you're doing now. And I'm sure people will have more questions for you later on. Again, just a reminder for people, if you have questions as our panelists are speaking, you can just put them in the chat box. So now I'd like to invite Sue Mackie Andrews to give her back. I'll turn it over to you, Sue.
Thank you, Mackenzie. So it's interesting to follow TT. I entered into the public health world late in my last career. So this was not a planned field of study or work, and I'm probably the least formally credentialed of anybody here on your panel today. But I've had several major influences. My educational background is pediatrics, and I did a few years in medical school focusing on pediatrics and became a pediatric diagnostician, and moved to Maine about 43 years ago to focus on pediatric practices in disability. And have had a good career in that, both in Maine and nationally. But have always lived here and traveled from here when I was doing national consulting work. And one day I can remember coming home and realizing in this very rural, I live in one of the most rural counties in the state, Piscataquis. Um, and, you know, um, always knowing that we were poor, always knowing for almost all the time I've been here. And most recently in the last 15 years, our health metrics for all of our population, up and down the age spectrum, are the poorest in the state. But all of a sudden, when you're gone and you come back and you ride around, you see the differences and you see how deep the poverty has become and how poor the health metrics are. I started doing some research about that. So that was one of the most influential pathways of change for me. I was doing some public health consulting at the time, looking at improving practice work. But my opportunity came in the early 2000s when we invited doctors Vincent Felitti and Rob Anda to come to Maine and talk about adverse childhood experiences throughout the state of Maine. And so my privilege was, for about a year and a half, was to drive them up and down Route 95 here in Maine. And we'd get off at various exits and go to the local hospital and they would give lectures. And we would have the most powerful conversations about the impact of ACEs and social determinants of health on health and the welfare, not only of our neighbors and friends, but also of our communities. And it got me to really thinking of my whole pediatric career, very similar to what TT just said. I was out in homes and I was doing clinical work. And that home experience, that home visitation experience, really changes how you do your work. It changes your perspective, it changes your intervention and your support strategies, and it makes you think a lot more expansively about how all of this stuff comes together. And so I really started to make a change. I started the Maine Resilience Building Network with others and was fortunate to travel around the state for about 6 years, doing training in ACEs to many of the institutions that you folks are coming from, as well as many high schools throughout the state of Maine. And I found, my niche, I guess, in community mobilization and advocacy. And that's really what I do now. I'm pretty retired, although I probably work more now being retired than I did when I was getting paychecks. But it's been really rewarding over these last 2 years of the pandemic to lead our local COVID health task force, which is now morphing into COVID recovery and community resilience building. And I'm part of the public health movement in the state. And really, I know we're going to talk more, but I see this as one of the most exciting opportunities for growth and development in Maine. At the local level, we've been invited, public health all of a sudden is real and it's apparent. And it's, most people don't know that they are part of the public health network here in our state. And so I see us as having tremendous responsibility and opportunity. And I'm just blessed and grateful to be part of it. Thanks.
Thank you so much, Sue. Yeah, your experience is really interesting and valuable. And yeah, your work in adverse childhood experiences and social determinants of health is so important. And It's interesting to hear your perspective, especially on how the public is viewing public health now and really getting to see public health in real time. I think that's really important. So thank you for sharing that, and I look forward to getting to ask you some questions. Right, so now I'd like to invite Carol White to give a little introduction and describe your public health experience and career for us.
Thank you, Mackenzie. Good afternoon, everyone. So my experience is a little different, and it started back in Jamaica. I'm from Jamaica, and I was a person who was a hardcore bench scientist, you know, those people. My first degree was in biochemistry, physiology, and I also did like parasitology. So, you know, those real sciencey things. And my first job was at a pharmaceutical company. And that summer, that was right after finishing my first degree in biochemistry and, you know, microbiology. And I was there in that lab, and I was testing stuff, doing all the things you do in the lab. And then I had some great colleagues, but then I realized that I don't think I want to have a career that's in a lab with test tubes, centrifuges, all those fancy things. I realized that I think I prefer people over these equipment. So when I decided to do a postgraduate study, I chose to do it in nutrition with a group which is a child development group. So it was not nutrition in the sense that most people would think, where you think of dietetics. What we did was look at health outcomes that could have a nutrition, you know, base. So it was like looking at stunting among children, and you look at all the social determinants of health. And of course, one of them, that's a big thing in there, it's nutrition. We also looked at things like the mother's health outcome during pregnancies. And so they all had a nutrition focus. And I realized that, you know, I was very shy, which is probably why I chose the lab science. But my advisor, she decided, she saw something in me that I didn't see at that time. My ability to get folks to do what you want them to do. So she sent me out into the field to be as a, you know, I was doing my master's at this time. So working as a research assistant, she sent me into the field to be collecting data, to collect data from folks and also to enroll them into studies. So you can't be shy doing that. So she's the one, you can blame her, you know, if you meet me, you can blame her for my ability to get what I want. So I realized I really liked working with the mothers and the children and, you know, the families. And so that's where I decided to do my doctorate. So she was the same person who was my advisor for the master's and the doctorate. And then, you know, I finished the doctorate, and then my husband decided that we should leave Jamaica, come to the US. He got a job offer at General Motors. So it's like, okay. So I migrated to the US. And then I was able to get a position at Brown University, where I was able to continue working in women's health, looking at things like, you know, cancer, breast cancer, cervical cancer, and all the social determinants of health that affect different levels. Why is it that the underserved women have worse outcome? They tend to have late diagnosis, and they tend to die more from these cancers. So looking at those things, and then I also was able to stay with my child development research in different ways. Then I moved to Maine. I was at Maine Health for a while, and eventually ended up at UNE in this program. So that's kind of how I got here. And I'm happy to answer any questions that folks may have after this.
Great. Thank you so much, Carol. Your journey is so interesting. And I've noticed so far we have a trend in pediatrics and maternal health, which is really interesting. Did not plan it that way, I promise. But thank you so much for sharing your experience, all of the important work that you do in your journey. All right. So we're going to continue on our pediatric trend, and I'd like to invite Kaylee to give us your career experience and talk about how you got to Children's Oral Health Network.
Sure. Hi. So I'm Kaylee Hess. You know my background anyway, I'll just get right to it. So I got into public health. I started out with an anthropology background, and I remember reading the book, The Spirit Catches You and You Fall Down, which if you haven't read it is pretty interesting. And I had my eyes open to this whole world of public health that I had never even considered. And you know, the more I learned about it, the more I knew that was something that I wanted to explore. So after graduating from undergrad, I actually worked at a federally qualified health center that serves immigrant farm workers in Maine, or migrant farm workers in Maine, doing a lot of health education and things like that. And I pursued my Master of Public Health degree at the University at Albany in social behavior and community health. But I was always really fascinated and passionate about health policy too. And all my friends in school were like, why aren't you doing the health policy track? And I was like, I don't know, this seemed like a good idea too. So I started down on that track, and I ended up working locally at a Healthy Maine partnership, which some of you might have heard of. It's they used to be kind of what in lieu of county health departments, they were kind of what we had locally in Maine to do some of the core public health work that we know needs to happen. So I started working in that, mostly in substance use prevention. So coalition work, a lot of coalition work. And I liked that work pretty well, but I really, really wanted to work more at the state level. Again, I was really interested in policy and some of the bigger picture public health work. And I knew I had this itch to like just be at a little bit of a bigger scale. So I ended up getting a new job working to support the Healthy Maine partnerships at the Maine CDC. And that is all a little bit political here in Maine. So needless to say, eventually the Healthy Maine partnerships were no longer supported by the Maine CDC, and I also lost my job as a result, which is fine. I landed very gracefully actually supporting federally qualified health centers through policy and various things that health centers need help with in order to serve underserved people in the state. So I ended up working at another state level advocacy kind of organization to support federally qualified health centers. And that's when I feel like my public health career got pretty exciting, actually. It was always interesting, but it got really exciting at that point. I got involved in vaccine advocacy. I helped pass a law to require vaccination for children in schools, to require that they be vaccinated and caught up on vaccines. And through that process, it really opened up my eyes to the need for public health policy at the state level, and notably the need for legislators who understand public health a little bit more and who are advocating for evidence-based public health policy. So not shying away from a challenge, I actually decided to run for state senate to represent where I live, because the person who I ran against was actually he spreads a lot of significant amounts of public health misinformation. And so I felt it was very important, especially in the middle of the pandemic, that someone who believes in vaccines and things like masking would run. And so I ended up running for state senate against him. And unfortunately I lost, but it was just eye-opening in terms of how interlinked public health and politics and policy are, and how important it is for everyone at whatever level that you are working in public health to be able to find how you can be persuasive and speak to legislators, speak to everyone about the various public health policies that are constantly, going in front of state legislatures, because there is just more than I think anyone realizes that can hurt or help public health every legislative session. So that was when I think my career got a little bit more interesting. And now that's the sort of thing that I do for fun is, pay attention to public health policy. But in my real job, I work in oral health, which also has a lot of policy implications. And oral health, children's oral health is a real equity issue. A lot of kids are underserved in general in Maine. You don't think about oral health until you have bad oral health. And a lot of the folks who are working in positions of power have always had access to the tools that they need to stay healthy and to have good oral health. And so it often gets left out of discussions about health and public health, but it ends up affecting kids' ability to learn, to eat, to be confident, to get jobs later on in life. So that's where I'm working right now. And it's been an interesting journey to get here, but I hope that was helpful or interesting for anyone.
Thank you so much, Kaylee. That your background is so interesting, and I think we all really enjoyed hearing about your intersection in public health and policy and politics, and then also your work in oral health. Like you said, I don't think it's something that is always at the forefront of our minds as kind of a determinant of health. That's really important, and I'm sure people will have more questions for you. So next, I would like to invite Ivan Most to give his introduction and talk about his occupational health. Ivan.
Thank you, Mackenzie. It's a pleasure to see so many of my students here. One of the things I miss with online teaching is I don't get to see my students a lot. So this is really wonderful. I travel through public health maybe from a little different perspective than a lot of folks. I'm an engineer by profession with my degrees in BS and MS in engineering. But as I think about my career over many, many years, I realize that public health was always there. As a matter of fact, the canons of ethics for engineering, the first canon talks about the fact that we should not do anything that affects the health and safety of society. And certainly if we take a look through the newspapers and we see the 737 MAX disaster, and some of the things that happened to Miami Towers down in Miami, Florida, we can see what role engineering plays in the health of the community. Even from the start of my career working for General Electric in designing nuclear reactors for submarines for the Navy, there was certainly a health aspect. We were responsible for designing something where that would be within 20 feet of 200 or 100 people at least for 6 months of the year, and that's a nuclear reactor. And so the exposure in public health is all about exposure. The exposure in the workplace is something that I've always had in my career, but it came to fruition a little bit late in my career after a career as an engineer and as a professional engineer. By the way, the PE after my name, if you see, means professional engineer. Engineers are a licensed profession, much like doctors and lawyers, and the PE is the license. But anyways, late in my career, I got asked to help start the engineering program at USM. And I do teach public health at UNE, but I teach engineering at USM. So I do teach two different topics. And so one of the things I did in that starting program was to help manufacturers in the state of Maine become a little bit more efficient and more competitive. And when we went around and talked to a lot of small manufacturers in the state, because most manufacturing in the state of Maine is small by national standards. Most of our factories are under 100 employees. And actually small business, according to the federal government, is under 500. So 500 employees in the state of Maine would be a large company. Most of these companies that were experiencing very high levels of workers' compensation, there was a good reason for it. Because of the way their workplace was designed, they were injuring their workers. There was no secret about that. Not that the workers' comp system in the early 90s in Maine was not corrupt, it was, but there was an awful lot of problems in the workplace. So I helped start a USM, something called an annual ergonomics conference. Ergonomics is matching up people with machines, and ergo means work. So we ran this conference, and as that conference developed, we had speakers from University of Mass Lowell, which had a work environment department as part of their engineering program. And they talked me into late in life going for my doctorate. I don't recommend it to anybody, younger folks. That's not a good way to do it. It's better to do it when you're young. But I did take my doctorate at UMass Lowell in work environment policy with a minor in ergonomics. And since that time, I have done a lot of work in the field. We're looking at industry, looking at injuries in the workplace. I think this is going to become a much different field of public health in the future. The pandemic showed us that many of us can work at home. I certainly teach out of my home, almost all my classes now online. But the question we have to answer, is the home the best place for a workplace? Is it designed properly not to injure the people that are doing the work? And furthermore, when you do get injured at work, what policy do you fall under? So I think occupational health has an awful lot to do with exposure, which is one of the keys in public health. It has an awful lot to do with policy, and it's going to change dramatically in the years to come. In my engineering class, my students took a look at artificial intelligence and how that's changing the world of manufacturing. And so as machines take over and people step up to a different role, that role is going to have different exposures. And one of the major exposures that they'll have is psychosocial in nature. And so we're going to be looking at workplace stress in a different way, and could actually become one of the key workplace injuries and illnesses that we need to deal with in the future. So I think the field is exciting. I think it's exciting for people with public health degrees to think about. If you do have an MPH, you can find yourself working for a workers' comp insurance company, for example. You could find yourself working for an industry, or you can find yourself working in a hospital dealing with the many issues of occupational health that nurses and nurses' aides deal with, especially when they have to start doing a lot of lifting. So I think the program, or the occupation of public health in the occupational health field, is going to change in the future, and it's going to become very, very important. You've got to remember that 1/3 of our life is spent at work. And so our exposures at work are ones we really need to be conscious of and consider. So I welcome everybody to answer any questions I can about the field. And thank you once again, and it's an honor to be part of this group. Thank you.
Thank you, Ivan. That was such an interesting talk about occupational health and your journey in your career. I know a lot of people kind of have said they haven't had the most traditional journey in public health, and that's one of the things I think is most interesting, and what a lot of people are drawn to is everybody can work in public health. And your comments about occupational health and how that is going to change through the lens of the pandemic was really interesting. And I agree with you. I think that we're going to see things change in the next few years. So thank you so much. And people asking some questions. So lastly, Yvonne Jonk of the Maine Rural Health Research Center, and also at the Muskie School of Public Health at USM, is our last speaker. So at this time, I'd like to invite Yvonne to share your experience with us.
Thank you, Mackenzie, and it's very nice to be here. And I think, like most of the people on the panel, that things were definitely not a straight line path for me. So I grew up in the Midwest. I'm a farm girl at heart, and you know, I learned to drive a tractor before I was in a car. So and I grew up loving agriculture and And when I went to my undergraduate to earn my undergraduate degree, I started off with animal science and agronomy, and agronomy is basically farming. And that was my undergrad degree. But I knew that at the time that I really loved economics, and that was really what I think was my strong suit, was really the quantitative piece of economics. And I really enjoyed learning about markets and how markets work and when they don't work. And so from there, from my undergraduate degree, then I decided, no, I'm gonna follow economics. So then, because my background was in the ag industry, I went after ag and resource economics, right? That makes sense, right? So I went off to earn my master's degree at Colorado State University, and finished that degree. And along the during the time that I was working on my master's, I met some people who had earned their PhD from the University of Minnesota, and I really wanted to go back to the Midwest. And I started, even when I was working on my master's, I knew that I really loved the university environment. And so I thought, well, maybe I'll just keep going, right? And I'll earn my PhD, and I'm going to try to get an academic position and start teaching, because I love teaching. And it's going to be in economics. So I applied for the economics department at the University of Minnesota and got in, and it was very competitive at the time. So I was feeling pretty lucky. And but in my application to graduate school, I put in that I really wanted to study rural health issues. And that never left me. And it was really, a product of my environment, right? That I had grown up on a farm in the Midwest, knew how difficult it was for my parents. We're a family of 7 kids, to obtain health care and pay for it, and etc. So I put that in my application. And it was at a time when health economics wasn't even a thing, much less rural health economics. But anyway, there you have it. So I finished my PhD then, and then I started working within the Twin Cities at the VA Medical Center, and it was all about veterans issues, access to care, and etc. So that's really well, I missed a step there, because while I was in graduate school, I had the opportunity to kind of pave the way to develop a public health minor in the economics department. So another student and I paved the way, and that public health minor really involved a lot of classes in the health services research arena, which is what I spent a good majority of my time hobnobbing with a bunch of health services researchers and health economists during my PhD. So from there, I went to work at the VA Medical Center. Still wasn't doing rural health, right? And so I spent 6 years there, and then I ended up contacting Ira Moskovich, who is the department head for health services research at the University of Minnesota, and he was doing rural health at the time. He had one of the 6 or 7 rural health research centers that he was directing at the University of Minnesota. So I let him know that, this is what I wrote my application for. If there's ever an opportunity for me to come back to the University of Minnesota and work with you, please let me know. Well, in the meantime, I decided, I've seen the public sector, right, with the VA, and I wanted to. I was asked or recruited by Park Nicollet Research Institute, which is another institute in the Twin Cities, to come to the private sector and help them figure a few things out. And boy, that was a learning curve for me. That was, when they say, get outside your comfort zone so that you develop a more, you have a better appreciation for the sector that you're working within. And that was definitely what happened to me there. You know, I didn't stay there very long, but it was long enough for me to understand what was going on. You know, because I think when you're in graduate school or, you know, in the academic environment, it isn't until you get out there, right? And you you actually step out into the world and see how things are working and are not working, right? And that's what I really appreciated when I went to the private sector. I started understanding what those clinics were doing, those provider systems were doing to stay out of the red. And because of my training, they exposed me to that. They, you know, I was an economist, right? So to them, that meant dollar signs, and that, you know, that I would be interested in understanding how to keep them out of the red. Well, it only took a couple years there, and I was recruited back to the University of Minnesota to do rural health. And of course I said yes, because that's what I was begging to do all the way from, you know, when I first went into graduate school. But I took a huge pay cut, guys, because when you move out of the private sector and go back to the academic environment, guess what? Yeah, that is not like a profitable move. But anyway, I always tell my students now when I teach that it's not about money. It, you know, life is more, it has to do about the quality of your life and what are you passionate about. And anyway, so once I came back into that, you know, academic environment, I stayed there. I did move from a particular, a certain number of universities. I mean, I was started at the University of Minnesota, then I went to the University of North Dakota, and then I ended up at the University of Southern Maine. There's a story there too, but it was all about rural health and doing it and continuing to hobnob with rural health researchers. So I'm very happy now that I'm here. And, you know, rural health is really all about population health, right? It's all about the social determinants of health, and, you know, what stops people from getting vaccinated, for example. And we know that, you know, that's a big problem in rural. There's you don't have quite, it's not just an access issue either, though. It's also, you know, there are a lot of cultural barriers and misinformation going on, et cetera. And a couple of people have alluded to that, but I'll stop there. Thank you. So it was definitely not a straight line path. I went like this. Yep.
Thank you so much, Yvonne. Your experience is definitely a kind of a new perspective. I think yours is another topic or field that not a lot of people consider, particularly economics and public health, is obviously really important and something that I think people will be interested in learning more about. So thank you for sharing that experience. All right, 15 minutes left in the hour for questions. Again, to all of our attendees, if you have any questions, please feel free to put them in the chat. And I will start us off with a question to all of the panelists. This is one that was sent in by a student, and the question is, how can we do a better job as public health professionals to brand and promote the work we do? Oftentimes, community members don't know about the work we do daily until they need us. Feel free to answer that.
Mackenzie, I'll take a stab because that's what I do at the local level. I see that as my job. My responsibility is to seek out and find those people who have affinity to improve what's going on in our region, whether that's improving housing or access to prenatal care and well child care, or we struggle as we are. Piscataquis County is the oldest county in the state of Maine. Over 27% of our residents are over 65. And they face, most of them are women too, by the way, they face incredible social isolation and limitations being able to access services. And that has only grown more worse. So we have a number of irons in the fire. And one of my jobs is to find all the people who have affinity, who might have affinity with our work on community health outreach workers, who might have affinity on our work with school-based health services, who has affinity on getting home health services much more available to people in our region. And we've been recently approached by folks who are doing climate change and broadband, and some of those you may not think that they fit in with the public health world, but they all do. And so in a rural area like mine, I have a good friend who says to me, this is really a target-rich environment. There's nothing that you can aim to do that will fail, and you'll always be improving things for the people that live next door to you. So I encourage you to think about rural public health and the power of assembling coalitions and motivating people to do good work.
That's great, Sue. Thank you. Do any other panelists want to chime in on that question about what we can do to promote the work of public health and get people more aware? If not, then I think, Kaylee, you saw this question in the...
Sorry,
sorry, go ahead, Ivan.
I had myself muted, I'm sorry. Yeah.
That's all right.
The occupational health area, in terms of getting people, is really a lot of the work is done by workers' comp insurance companies with their loss control activities. And once you make companies aware of what they're doing, they don't consciously want to injure their workers. That's not what they want to do. And so once you give them some education, and this is once again, what we're doing today certainly is an example of that. Conferences that are detailed in this area are helpful too. Then I think people want to actually make these improvements. So I think it's a matter of just giving them the information they need. In many forms we can do it. And with the workers' comp insurance, it's the better they do, the less they pay. So there's a financial incentive.
Thank you for that input, Ivan. Kaylee, I'm gonna open up this question from Courtney at UNE, which is directed to you. And Courtney is asking if you could talk more about your experience with organizations supporting migrant farm workers in Maine.
Yeah, so I put the link in the chat. It's called Maine Mobile Health Program. It is what is known as a federally qualified health center, which are, they kind of came out of the 1960s, all the good stuff that came out of the 1960s to support people like Head Start, you know, the highway system, all these great things emerged out of that time. And the federally qualified health centers serve people who oftentimes rural parts of the state or underserved parts of the state, which can, or populations, underserved populations is the other kind of category that these organizations can serve. And so Maine Mobile Health Program, they have a couple of basically RVs that drive around the state, and they provide mobile health services to migrant farm workers that come to Maine with our crops. So there's up in Aroostook County, we have, you know, the potatoes and broccoli harvest that happens up there. And so some folks are stationed for work in that part of the state. There's down east, the blueberries, which is a pretty quick season. And then there's also apples and the fisheries kind of industries in the state. And so Maine Mobile brings this clinic around and provides care to these folks. And it's oftentimes their only health care that they receive. Because what happens is the farm workers often travel where the harvest is currently happening. So people might be coming from like oranges in Florida to blueberries in Maine, or, you know, what have you. So this is often the only place where they're able to get healthcare while they're kind of traveling around with the harvest. So it's a really cool program. I don't know if there's anything else you want me to say about it. I was working in health education, things like heat stroke. We brought dental clinics, actually very big need to bring dental clinics to these farm workers, and just basic care around managing chronic illness too. So that's a lot of what, there's case management too that this organization provides for folks who need a little bit more ongoing care as well, or care management, I suppose.
Question for all of the panelists. It's kind of broad about your career journey, but what are some of the biggest challenges or the biggest challenge that you faced in your journey through your public health career, and how did you overcome those challenges?
So I think I'll take a stab at that. I think for me, making the transition from clinical practice to public health practice was quite a bit of a stretch. You know, I found that I needed to learn, unlearn, and relearn some things. I was coming at public health purely from a clinical, you know, bedside, thinking of one patient and thinking of diagnoses and treatment plans and all of that. And then I had to quickly realize that this mindset isn't going to work for public health, that I needed to begin to see the community as the patient. So I guess that was probably one of the biggest challenges, was to reframe my thinking. And I think for all of us, sometimes just changing the way we think can be quite a bit of a challenge. So I found that to be challenging. And also, I want to say that, and I'm not somebody who backs down from challenges. I do like challenges. I found that another thing that I found challenging was not doing what I thought I was going to do as I was progressing through the field of public health, which in the end turned out to be a blessing in disguise, because so many times I would have wanted to go down one particular path and have one particular interest, and then there would be something that would just be like an impediment. So maybe my advisor would say, well, this is probably not the way you want to do this. Do you want to consider doing something else? Or maybe when I was planning for my practicum, I wanted to do something that I'm a quantitative person, so I wanted to do something more researchy. And then I found this fantastic practicum, but it was in policy. And I was like, policy? Where are the p-values? Where are the odds ratios? Give me some chi-squares. What am I going to do with policy? But you know, when I got that practicum and I had that experience with a nonprofit called Children's Defense Fund, Texas, it really honestly changed my life. It changed the way that I think. It changed the way that I processed information. I began to see how policy actually does drive a whole bunch of behaviors and just public health outcomes in general. So I guess for me, the challenges that I faced trying to do things the way that I thought I wanted to do ended up being really more of the propelling force that brought me eventually to be where I am today, and the skills and the knowledge that I've acquired along the way.
Great, thank you, TT. That's very valuable insight, and it kind of aligns with some comments from other panelists about getting outside of your comfort zone and challenging yourself and the way that you think is very important. So thank you. All right, do any other panelists want to chime in on that question?
Yeah, I just want to add a personal touch to this, because one of the biggest challenges I've ever had was packing up and leaving my home country to come to the US, when the only person I knew was my husband. So, you know, being in that space where the only friends you have are his friends. And until I was able to find a job where I started making other friends, you know, it was very odd being in that space. But it taught me so many good skills that I will forever be thankful for, because I realized that I had to advocate for me. I had to know when to ask for help, how to ask for help. And, you know, those are skills that you use in every aspect of your life. So for me, the biggest challenge in my career has been the personal piece of making that transition from one country, one culture to a totally different one.
And I want to second that,
Great.
Mackenzie,
Thank you.
Oh, go ahead.
No, you go ahead.
Okay, I want to second that, what Carol was saying, that, you know, it might not sound like I was coming from a different country, but my parents were immigrants from the Netherlands, and we grew up, I always, you know, with secondhand clothes and that kind of thing, you know, right? So for me, when I think my biggest challenge was overcoming the fear that I wasn't going to be good enough, right? And I think all of us have that fear, but you know, I couldn't speak English when I first started, you know, a school, and I was, you know, then coming out of the Midwest and going to a university, especially the University of Minnesota, making it into a program where I was competing with the Ivy Leaguers when I didn't even know what an Ivy League was. And so, you know, it was, I had to gain some confidence, I think, and I had good mentors, and that really made the biggest difference for me. So you can do it. I guess that's right, Carol? Yep.
Exactly, exactly. Yes.
Thank you so much for your input. I'm gonna pose one last question from Michelle, who posted in the chat. This question is, what are some of the opportunities for public health policy work in Maine?
I can try to maybe take that. Well, I actually would punt this back to MPHA. So Maine Public Health Association monitors so many public health related issues every legislative session. And I know you all pull together a really great, I think it's like weekly roundup of the issues that are popping up that are public health related in policy, like legislatively policy that's happening. And then I know, like in terms of jobs, I mean, a lot of the nonprofits in the state have some sort of policy arm to them. So, you know, I work at a nonprofit, but every legislative session, we do a little bit of work in public health policy too around oral health. And I mean, many of the organizations have kind of that aspect of work that they're also working on. I know that at the state of Maine, there's kind of like little p policy work, right? So working on making Maine Care work more effectively for people, like at the Office of Maine Care Services, or, you know, there's kind of that type of public health policy opportunities as well, if you're interested in that sort of thing. So there are a number of opportunities. Anyone else have anything that they'd add?
Oh, I'll just pipe in. We are the oldest state in the union, not by the time that we became a state, but by the people who live here. And so the opportunities in public health, I think, in Maine are going to continue to be in the geriatric area. I'm part of that group now, so I'm speaking from an experience. And we do have a very good infrastructure for public health with older folks in the state, I think. But maintaining that is going to be a challenge, and being able to deal with the older population in the state is going to be a challenge. And people are working longer, which gets back into occupational health. So that's a challenge. So I think there's some policy challenges in the geriatric area that's going to be interesting in the years to come.
All right, thank you so much, everybody. Thank you to our panelists for providing their input and experience and answering some questions, and everybody for attending. I'm going to turn it back to Heather to wrap us up.
Thank you, Mackenzie, and thank you so much to all of our panelists for being here this afternoon. I know we're all very busy in the public health field, and that's why we're so excited to have so many students who are interested in joining us and joining the workforce. I did want to mention we do have an opportunity with regard to policy work to become involved. We host 5 different member sections on an array of public health topics. And so we do a lot of educational events to legislators and the public health in general. But it's a great opportunity to network with others who are working in the field and to learn. And you can be brand new to public health and join these member sections, or you can be seasoned as well. And you can find more information on our webpage or email me, which I'm putting in the chat right now along with the evaluation. So please remember to take that, and I'll put that along with the recording in an email as follow-up. But again, thank you to all of our panelists, and thank you so much to all of you all for attending, and we hope we see you tomorrow morning at 9. And just a plug for APHA, they have an event at 5, which is just started on gaining employment after graduation. So hopefully you can tune into that as well. And again, many thanks to everybody and to Mackenzie for helping organize today. So thank you all and have a great afternoon.